they extend from the base of the skull downward to the level of the cricoid cartilage at the sixth cervical vertebra. It is situated behind and open anteriorly into the three opening, so its cavity is divided into nasopharynx, oropharynx, and laryngopharynx. It's long, about 12 centimeter. Its widest diameter is 5 centimeter at the base of the skull, and its narrowest point centimeter at the upper esophagus. So it is somewhat funnel shaped. The boundaries of the pharynx. Superiorly, the base of the skull, including posterior part of the body of the sphenoid and the basilar part of the occipital bone. Inferiorly, continuous with the esophagus at the level of the sixth cervical vertebra, at the lower border of the cricoid cartilage. Posteriorly, prevertebral fascia separated it from cervical spine, and anteriorly, communication with nasal cavity, oral cavity, and the larynx. On each side, it is attached to medial pterygoid plate, the pterygomandibular raphe, and the mandible, then the tongue, hyoid bone, thyroid, and cricoid cartilage. Also, communication with the middle ear through Eustachian tube on each side. Styloid process and the muscles attached to it also located on each side. And other structures, which is the carotid sheath, the common carotid artery, internal carotid artery, and external carotid artery. The wall of the pharynx. The pharyngeal wall look like four cups on one inside the other. The innermost one and the highest is what is called pharyngobasilar fascia, which is attached to the base of the skull. And the next three cups are the constrictor muscle of the pharynx, or the intrinsic muscle of the pharynx. Each constrictor muscle has an anterior small origin from which its fiber run out posteriorly to meet its fellow in the posterior midline, forming what is called the pharyngeal ligament, and it is called posterior pharyngeal raphe, which is extend from the base of the skull to the lower border of the thyroid cartilage. What are the structure of the pharyngeal wall from within to outer side? First, the mucous membrane lined by the stratified squamous epithelium. Second, pharyngeal aponeurosis and pharyngobasilar fascia. It is a fibrous layer lining the muscular cord. And the three cup, which is the muscular cord, consists of the outer circular layer, consists of the three muscles: superior, middle, and inferior constrictor muscle of the pharynx. The inner longitudinal layer also consists of the three muscles: stylopharyngeus muscle, salpingopharyngeus muscle, and palatopharyngeus muscle. And the fourth, which is the last, covering the outer surface of the constricting muscle, is what is called the bucopharyngeal fascia. First, what is the pharyngobasilar fascia? It is a strong fascia lines the muscular layer of the nasopharynx, and it is extend from the base of the skull to the hard palate at the level of the cervical, first cervical vertebra. The origin of the pharyngobasilar fascia from the pharyngeal tubercle in the base of the skull. The line of the origin goes laterally to reach the petrous apex, then it is passed to the base of the medial pterygoid plate, where it passes over the cartilaginous part of the uterine tube, and it takes origin from the posterior border of the medial pterygoid plate and medial to the superior pharyngeal constrictor muscle, where its origin ends at the level of the pterygoid humulus. It is responsible for keeping the nasopharynx always open for respiration. The pharyngeal constrictor muscle, superior, middle, and inferior. First, the superior pharyngeal constrictor muscle. The origin from the posterior border of the medial pterygoid plate below the cartilaginous part of the ureter tube and the pterygoid humulus, pterygomandibular raphe, and the posterior border of the mylohyoid line. The second, middle pharyngeal constrictor muscle. It is originated from the angle between the lesser and greater horn of the hyoid bone and lower part of the stylohyoid ligament. These two muscles, superior pharyngeal and middle pharyngeal constrictor muscle, inserted fiber as a fan. The upper fiber ascending upward, middle fiber go horizontally, and lower fiber go downward, all inserted into the posterior in the pharyngeal raphe. The third, which is the inferior pharyngeal constrictor muscle, divided in two parts, depend on the arrangement of its fibers. First, thyropharyngeals from the oblique line of the thyroid cartilage and the area above, and its fiber inserted ascend upward and medially to be inserted in the midline to the pharyngeal raphe. But the lower part, which is called cricopharyngeal part, a circular muscle, arises from the cricoid cartilage, and it's continuous with the upper part of the esophagus. There is a gap between its and upper part, which is the thyropharyngeal part, because it is its fibers running transversally, but the fiber of the thyropharyngeal muscle ascend upward. So there is a gap between two parts of the inferior pharyngeal constrictor muscle. This picture shows the pharyngeal constrictor muscle. So this is the mouth. If I examine the mouth, what are the structure you can see inside the mouth. First, from above downward. From above, you can see the soft palate, uvula. Then, on each side, first palatopharyngeal fold toward the pharynx, and below glossal fold toward the tongue, and between these two, palatine tonsil. Lower down, you can see the dorsum of the tongue, and deep to this structure, at the middle part, there is the oropharynx. Division of the pharynx. Because there is a three connection to the other structure below. I mean the nose, the mouth, and the larynx. So it is divided into three parts. First, the nasopharynx, what is called epipharynx, which is extend from the base of the skull to the soft palate. The second part, which is called the oropharynx, and it is extend from the hard palate to the hyoid bone. And the third part, which is called laryngopharynx or hypopharynx, extends from the upper border of the epiglottis to the lower border of the cricoid cartilage at the level of the sixth cervical vertebra. What are the extrinsic muscles of the pharynx? Three muscles. First, stylopharyngeus muscle, originated from the back of the root of the styloid process, and its insertion passes with the posterior border of the thyroid cartilage in front of the palatopharyngeus muscle. Palatopharyngeus muscle originated from the nasal side of the palatine aponeurosis and the posterior part of the hard palate, and inserted into the posterior border of thyroid cartilage. The third, which is the salpingopharyngeus muscle, originated from the lower border of the auditory tube and inserted at the back of the thyroid cartilage. This picture shows the extrinsic muscle of the pharynx. The relations of the pharynx. The relations of the pharynx, the upper part and the lower part of the pharynx. The upper part laterally related to the carotid sheath, which is containing internal carotid artery, common carotid artery, internal jugular vein, and the upper fourth cranial nerves. Lower part laterally related to the carotid sheath containing common carotid artery, internal jugular vein, and the vagus nerve. Posteriorly, it is related to the upper part. Posteriorly, it is related to the retropharyngeal space and containing sympathetic trunk at the posterolaterally. A lower part posteriorly, the same relations as the upper part. The upper part anteriorly related to the nasal cavity, and the lower part anteriorly related to larynx. Now, what is the nasopharynx? And what is the anatomical description of this part of the pharynx? Nasopharynx, it is the uppermost part. It is lies behind the nasal cavity. The roof of the nasopharynx, it is a part of the sphenoid bone and the basilar part of the occipital bone. The anterior wall of the nasopharynx, posterior nasal apparatus. Posterior wall arch of the atlas vertebra covered with the prevertebral muscles and fascia. The nasopharyngeal tonsil, which is called the adenoids, which is a collection of lymphoid tissue in the posterior wall near the nasopharynx roof. The lateral wall of the nasopharynx on both sides, it is open in the Eustachian tube near the roof, connecting it to the tympanic cavity. Surrounding to the opening of the Eustachian tube, there is what is called around the tubal opening, bounded by what is called the tubal elevation, which is collection of the subepithelial lymphoid tissue. The salpingopharyngeal fold and the mucosal fold arise by the salpingopharyngeus muscle, which is extend from the back of the tubal orifice downward. And second thing, the lateral wall of the nasopharynx is the lateral pharyngeal recessus, which is the fossa of the rosembular, lies posterolaterally in the walls of the nasopharynx. It is contained the levator valenti muscles, and it is immediately laterally to it lies the internal carotid artery. Inferiorly, it is communicate with the oropharynx. The nasopharynx, it is lined by this pseudo-stratified columnar epithelium. What are the lymphatic drainage of the nasopharynx? Lymphatic drainage to the deep cervical lymph node and to the spinal accessory chain of the nodes and the contralateral lymph node to the nasopharynx. Second part, which is called the oropharynx. It is a common respiratory and digestive pathway, open anteriorly to the oral cavity and superiorly to the nasopharynx. Structure in this part are first, which is called palatoglottal fold, a mucosal fold raised by the underlying muscle, palatoglottal muscle, separating the oral cavity from the oropharynx. Second, palatopharyngeal fold, a mucosa membrane raised by the underlying palatopharyngeus muscle. And the third part, in between palantoglossal and palantopharyngeal, is the palatine tonsil, which is two big collection of lymphoid tissue between palantoglossal and palantopharyngeal folds. And the fourth structure of the oropharynx, lingular tonsils, which is located in the posterior one-third of the tongue. In the middle part of the pharynx, the oropharynx is situated just behind the oral cavity. Lymphatic drainage of the oropharynx in upper to upper jugular chain, particularly to the jugular digestive lymph node, or what is called the tonsillar lymph node. The soft palate, lateral and posterior pharyngeal wall at the base of the tongue, the drainage into retropharyngeal and parapharyngeal lymph nodes. In relation to the oropharyngeal isthmus, there are several aggregations of lymphoid tissue that constitute what is called the Wurzel's lymphatic ring. So any infection in this part of the pharynx, it may disseminate to these group of lymph nodes. So it is a circle of lymph nodes. Submental lymph node, submandibular lymph node, jugular chain nodes, lingular tonsil, palatine tonsil, tubular tonsil, nasopharyngeal tonsil, and retropharyngeal node. All these form a ring in the pharynx. The second thing, which is called laryngopharynx, which is the lower part of the pharynx, situated behind and partly on the sides of the larynx. The hypopharynx, it is lies opposite to the third, fourth, fifth, and sixth cervical vertebrae. Clinically, it is divided into three regions. First, filiform sinus or the fossa. Second, both cricoid regions. And the third, posterior pharyngeal wall. Filiform sinus, it lies on the either side of the larynx. It is extend from the pharyngoepiglottic fold to the upper end of the esophagus. The internal laryngeal nerve runs submucosally in this lateral wall of the sinus. So, it is important in using local anesthesia in this part. Bounded by laterally by the thyroid membrane and the thyroid cartilage. Medially bounded by epiglottic fold, posterolateral surfaces of the arytenoid and cricoid cartilage. Both the cricoid region is a part of the anterior wall of the laryngopharynx. The posterior pharyngeal wall, it is extended from the level of the hyoid bone to the level of the cricoarytenoid joint. The lymphatic drainage, the piliform sinus to the upper jugular chain, posterior wall to the lateral nodes, deep to the cervical lymph nodes, and both the cricoid region drain to the parapharyngeal lymph nodes of the supraclavicular and the paratracheal chain. Nerve supply of the pharynx. It is supplied by the pharyngeal plexus of the nerve, which is formed by the pharyngeal branch of the vagus nerve, pharyngeal branch from the glossopharyngeal nerve, and pharyngeal branch from the superior cervical sympathetic ganglion. The motor fibers of the vagus nerve supply all the muscle of the pharynx except stylopharyngeus by the glossopharyngeal nerve. The sensory fibers, glossopharyngeal nerve, and the vagus nerve. Pharyngeal spaces, which is the potential space in relation to the pharynx where the abscess can form. First, retropharyngeal space lies behind the pharynx and extends from the base of the skull to the bifurcation of the trachea. The parapharyngeal space present on each side of the pharynx contain carotid vessels, jugular vein, and the last fourth cranial nerves and sympathetic chain. What about the applied anatomy? A large adenoid lead to nasal blockage, block the auditory tube, recurrent ear infection, and lead to reduced hearing. Pharyngeal diverticulum means herniation of food containing within the mucosal pouch through the gap between two parts of the inferior constrictor muscle, and it is seen as a swelling at the side of the neck. Thank you very much.